This is Preeti and you're watching Med Solution. In this video, I'll be marking you all the important questions from Introduction to Hematology and Disorders of red blood cells. That is all of the RS questions I'll be making you mark. The first question will be the anemia. Anemia is most important question. They will be repeatedly asking. Anemia they'll ask, and the classification they'll ask, etiological classification. Along with that, any other sub question they'll be asking. Anemia, so definition of anemia is important, classification is important, and then this etiological in classification, etiological classification is important. And another questions from this this page will be red cell indices, that is mean corpuscles volume, also separately they'll ask for 3 mark question. Mean corpuscles hemoglobin concentration also they have already asked you for a 3 mark question. And coming for the next page, the clinical features of anemia is important. And next page, in iron deficiency anemia, they'll ask laboratory findings. In laboratory findings, you have to write both peripheral smear and bone marrow examination. Mainly peripheral smear is important because they have asked separately again for the 3 mark question. And clinical features of iron deficiency anemia is important. These are the sub questions they usually ask you. And in megaloblastic anemia, again in everything there will be clinical lab diagnosis will be lab diagnosis of megaloblastic anemia is important. Pathogenesis of megaloblastic anemia is important. Then difference between the normocyte and normoblast and megaloblast is important. Then in pernicious anemia, etiology is important and lab findings are important. Lab findings are important in each and every type of anemia. And reticulocyte count, normal count, abnormal count, and they define reticulocyte and everything will be important. And where it is increased, reticulocytosis is also important. In aplastic anemia, this will be asked for a 3 mark question or 5 mark question. You need to know everything. And pancytopenia is important for 3 mark question. Causes for pancytopenia. Then hemolytic anemias, definition and classification are important. Then lab findings of hemolytic anemia are important. Hereditary spherocytosis is important. In hereditary spherocytosis, you need to know the morphology of hereditary spherocytosis, and etiopathology is important in hereditary spherocytosis. Coming to the next thing, the thalassemia classification is important, and pathology is important. In beta thalassemia, the lab findings are important. In lab findings, especially peripheral smear findings. Then sickle cell anemia, etiopathology is important, and complications of sickle cell anemia important, and crisis in sickle cell anemia, lab findings, diagnostic confirmatory test, that is sickling test is important for 3 mark question. RH incompatibility is important for 5 mark question, and lab findings of sickle cell anemia are important. That's all for this chapter, and remaining 3 mark questions are left out are these reticulocyte, bone marrow aspiration that you will be seeing in other chapter, and indications and contraindications of bone marrow aspiration, this you will be seeing in other chapter. Pancytopenia as already said, and then anisopolykilocytosis is important for 3 mark question. Target cells important for 3 mark questions. Spherocytes important for 3 mark question. In reticulocyte, you need to define the reticulocyte and morphology of the reticulocyte. Staining methods or techniques used in reticulocyte is important. And normal value of the reticulocyte is important, and abnormal value is also important. And then utility of reticulocytosis, what are the causes and significance are important. These all only these are the questions important for the in this chapter. But you need to know about the 10 mark question. You need to be well thorough with the anemia for a 10 mark question, that is classification, definition, and all laboratory findings of all the types of anemia is important. Along with that, aplastic anemia separately, and then spherocytosis morphology is important. And this 3 mark question, pancytopenia, spherocytosis, then polykilocytosis is important. And the reticulocyte count important, and bone marrow aspiration you will be learning in another chapter. This is all important. These are the important questions from this chapter. If you find this video helpful, please do like, share and subscribe to my channel, and if you have any suggestions, let me know in the comment section. Thank you.